Hello everyone and welcome to today's Facebook Live with GBMC Healthcare. It's January and we are talking about cervical cancer awareness. So let's welcome our guest, Dr. Kimberly Levinson, Director of Johns Hopkins Gynecological Oncology at GBMC Hospital. And we want to hear from anyone watching, okay? So please don't hesitate to ask us your questions. Well, welcome Dr. Levinson.
Thank you so much for having me.
Well, thank you for being here. Okay, so cervical cancer, we hear about it, but what is it?
Yeah, so cervical cancer is essentially a cancer that begins in the cervix,
Okay.
which is the opening to the uterus.
Okay, and so what causes it?
Yeah, so the virus HPV or human papillomavirus is the cause for about 99% of cervical cancers.
Wow.
So HPV is a virus that is actually a sexually transmitted disease, but it's not a sexually transmitted disease like we think about gonorrhea or chlamydia, those types of sexually transmitted diseases. It's actually more like the common cold. So just about everybody who's sexually active gets this virus,
Wow.
but most people clear it. And just like a pneumonia, some people who develop a common cold will go on to have a pneumonia, and we're trying to catch those people where the virus kind of persists and doesn't go away.
Wow, okay, so all of this because of HPV. Are there any symptoms?
So usually not, actually. So the goal is to kind of catch this before it creates symptoms. So symptoms can arise if cancer progresses. So people can have bleeding, they can have bleeding after intercourse, they can have pain sometimes, but usually those are symptoms that actually arise once the cancer has started to kind of progress a little bit. The goal for us is to actually catch any changes early on through the screening process and then be able to take care of those before they become a cancer.
Okay, so is there any way to lower your risk?
Yes, so there's essentially two primary ways that we can lower the risk of cervical cancer.
Okay.
The first is through primary prevention, which is the HPV vaccine. So most people have heard about the HPV vaccine, getting your children vaccinated. The ideal is to prevent anybody from getting this virus, and the way to do that is through the vaccine. If people have already acquired the virus at some point, then really the best way to prevent cervical cancer is through cervical cancer screening with both the pap smear test and the HPV test.
Okay, so let's say you do have HPV. Does that mean that you will get cervical cancer?
So no, and certainly, you know, as I said, most people actually will acquire the HPV virus at some point in their lives, and most people will clear it on their own. The problem is that sometimes that virus kind of hangs out in those cells of the cervix, and then if it hangs out there long enough, it can start to make those changes to those cells there, which can go on to progress and become a cancer.
Okay, so it's really common then. So let's say a woman comes in and they find out that they have HPV. What happens next?
Yeah, so it depends on what the other findings are,
Okay.
and if that virus has started to cause changes to the cervical cells. So if the virus is there, that actually isn't necessarily an indication to do anything differently.
Okay.
Many times we just watch it and make sure that there aren't cells that will progress on to become abnormal. If there are cells which have become abnormal, then we have to start thinking about if those cells are abnormal enough that they need to be removed in order to prevent a cancer.
Okay, are there any risk factors?
So there are a couple of risk factors. The biggest one is patients who are immunosuppressed. So their immune system isn't as good for whatever reason, okay? They may be on immunosuppressive medications. They may have a medical condition that makes them immunosuppressed. And that just means that your immune system isn't fighting things quite as well. And so that kind of makes sense. In those individuals, they may not be able to clear the virus quite as well. The other thing that actually is associated with cervical precancers or dysplasias is smoking tobacco.
Wow.
So yeah, so that really increases people's risk. And a lot of times I'll say to patients, you know, if you don't want to keep coming back to me and seeing these abnormal cells there, certainly quitting smoking is something that can help that.
Really? I'm surprised by that. I mean, I don't smoke, but I'm surprised by that. Are a lot of patients surprised when you tell them that?
Yeah, I mean, I think, you know, smoking is obviously something that can affect so many different things. And so I think, you know, some people have an idea that there's so many different aspects of health that are involved. But yes, most people don't know that specifically, cervical cancer and cervical dysplasias are related.
Wow. Okay. So best way for cervical cancer to be prevented.
Yeah. So number one is vaccination.
Okay.
So that's really the best way that we can prevent people from even getting the virus. But number two is we can pick up these early changes with cervical cancer screening. And so if patients are screened, then we really do have the ability to prevent this type of cancer.
Okay, so let's talk about the vaccine because, as you know, we spoke right before we started.
Yeah.
I got the vaccine. A lot of my friends don't. Some people are all vaccination leery. But with this one, it seems like it's a no-brainer, right?
Yeah.
How do you tell people? How do you sell it to them?
So for me, I see cervical cancer patients all the time.
Right.
Okay. And everybody, I feel like, is looking for that magic pill to cure cancer, right? Everybody wants, that something that they can take if, cancer affects their family or somebody that they know or themselves. And the way that I kind of try and say it is, this is our prevention.
Right.
So we might not have a magic pill that cures cancer, but we actually do have a magic vaccine that prevents it. And it prevents not only cervical cancers, but all cancers that are caused by HPV.
Wow.
And so, I think, when you think about your children, or when you think about in particular, because that's where we really want to start vaccinating people so that we can prevent them from getting this virus, this is your ability to be able to prevent these types of cancer in your children.
Okay, I want to get back to that and talking about prevention. We do have a question, though, from social media.
Yeah.
So Susan says, how early should women start screening for HPV?
Yeah, so this is a really good question, and our screening guidelines actually change based on age.
Okay.
So actually women start cervical cancer screening at age 21, but we don't do HPV testing at age 21.
Okay.
So from 21 to 30, we actually only do pap smear screening.
Okay.
So women who are 30 years old then have the option to do pap smear screening and HPV screening together. That's called a co-test. And the reason for that is honestly because HPV is so prevalent in women who are ages 21 to 30 that picking it up at that point doesn't really help us to understand who's going to go on to get cervical cancer. It's really once, women have become at least 30 or older that we start to see, where this virus is persisting, and that really is the cause of cervical cancer.
Okay, we have one more question from social media. Okay, Christy asked, at what age should children be vaccinated against HPV?
Yeah, so really, they can start as early as 9, and it goes up from there. Ideally, we want to get them vaccinated early. So that's the goal is, as early on as we can catch them before sexual intercourse.
Okay, I have a follow-up question.
Yeah.
And then we'll jump in there going back to the kids. Let's see. Another question. Okay, Christy. Good question, Christy. Should boys and girls be vaccinated?
Yes, they should. And so there's a lot of reasons why boys and girls should both be vaccinated. HPV is a virus which actually affects both boys and girls and can cause cancers in both boys and girls. And in fact, it's the oropharyngeal or head and neck cancers that are actually really steeply on the rise these days. And those many times can be related to HPV. So not only because transmission goes back and forth with intercourse, but also because boys themselves may be affected by the virus, and that can cause cancers in them as well.
Right, and so we had this discussion here. I have teenage boys in the home, and we got the vaccine for them. But for a lot of parents, they don't really like the idea of getting their kids vaccinated against something that involves sex.
Yeah.
How hard is that?
Yeah, so that can be a challenge, but again, I think the most important thing is that don't relate it to sex, relate it to cancer. Right? Okay, so this is a vaccine which can prevent these types of cancers. And yes, we want to prevent the virus before somebody contracts the virus, and that's the main way that we can do that is by catching people young. But this is a vaccine that prevents cancer. It's not a sex vaccine, this is a cancer vaccine.
Perfect. Okay, so we talked a little bit about the screenings and who should get them and when you should get them, but then how often should they be performed?
Yeah. Can I jump back to vaccines for 1 second? Is
please.
that okay with you? Because I do want to also make clear that, we ideally want to catch people when they're young, when kids are young, before they've initiated sexual intercourse.
Right, I was going to ask you why 9?
Yeah.
Okay.
But actually, people can get vaccinated up through age 45 now. So the vaccine is approved for people up to age 45. And the thing is that, there are many different HPV types or HPV strains that can cause cervical cancer. So even though we know, yes, somebody may have acquired one strain of HPV, or we still can prevent many others. And so really getting vaccinated is important, even if you're not, even not for children, but as we age as well.
And so why did that change? Because when I got this HPV vaccine, the recommendation was to stop it at age 26, but now you're saying 45. So what made them give an extra almost 20 years to the back end of that?
So it really was just waiting on studies that proved the efficacy in these populations, improved safety in these populations, and all of those things. So our original studies, they really looked at those younger women, and so that was the age that it was approved for. But now we've seen the studies start to come out that say, yes, there is efficacy for this vaccine further along.
Okay, so let's talk about the studies. So they show the vaccine works.
Yeah, absolutely.
Okay.
100%, and that it's safe, most importantly, that it is safe, that there are not increased risks with this vaccine.
Okay, so have you seen a difference in your office as far as the age group of people who were able to get it and then the amount of cervical cancers?
Yeah, so we actually see changes in populations is really the best way to look at that. And the best example is Australia, actually. They were very successful at their vaccine initiative. And so we've had relatively low vaccination rates, unfortunately, with the HPV vaccine here in the US. We're increasing those rates, luckily. But in Australia, they really put forth an excellent vaccine strategy up front. And so most women and men were vaccinated early on, and they really have start to see a huge reduction, not only in cancers, but also in warts.
Wow,
so we see it across the board for HPV related things, and they actually are set to eradicate cervical cancers. So, that I think is the best evidence. We are seeing it in the US now, some of these decreases in trends across populations, but it's really about, doing a better job with getting the vaccine out and getting people to get vaccinated.
Wow, okay, and so you mentioned warts. So what does HPV do?
So there are different types of HPV, and this is where that comes in.
Okay.
So there are what we call low-risk types of HPV, and then there are high-risk types of HPV. The high-risk types of HPV are the ones that actually cause cervical cancers.
Okay.
Low-risk types of HPV, which can also be acquired sexually, actually cause condyloma or warts. And so those are the ones that cause that. So our vaccines actually cover those types of HPV as well. And so we can prevent that as well as the cancers.
So is there a way to tell when somebody comes in which
type they have? Yeah, so we do have HPV typing, and we do use that. And that's particularly because there are certain types which actually are what we call more oncogenic, which just means that they're more likely to cause cancers. And so we can kind of look at that and try and help decide who needs further screening, which gets back to your other questions, which I'm sorry I interrupted you on.
You're fine. I'm taking it all in. I'm sure our viewers are too.
Yeah.
Okay, so then what happens as far as the screening goes? Somebody comes in, they have HPV.
Yeah. So with HPV, we're actually looking for the virus itself, but we're looking for the changes that happen in the cervix as well. So those things together help us to determine what needs to happen next for patients. And it's really once the changes in the cervix have become what we call high grade, or have started to make changes that look like they're going to progress towards cancers, that we actually need to do something to remove those cells before they become a cancer. So depending on what the screenings show is really how we make decisions about what clinically needs to happen.
Okay, so if cells are removed, then what? Are they cured, or is it still something they have to watch for?
Yeah, so it is still something that we need to watch for. So we know that there are areas in the cervix that are particularly prone to this virus and to having HPV hang around there per se. And so those are the areas that are most likely to be involved with a cervical cancer. That's why penile cancers are less common, actually, because those cells are less susceptible to the HPV virus. It is these particular cells in the cervix that actually are most likely to go on harbor the virus and then have those changes. So when we perform a procedure that removes those cells, the risk decreases certainly, and most importantly, we're removing the cells that are abnormal, but the HPV virus can still act up and affect other cells that are still there.
Okay, so let's say that a woman comes in and she does have cervical cancer. What type of treatment is available?
Yeah, so there's a lot of different treatments that are all based on what stage we find the cancer in, how early it is essentially, and what's involved with the cancer. So those treatments can involve surgery, they can involve chemotherapy, and they can involve radiation as well. But it all depends on what stage the cancer is in and essentially what is involved with the cancer.
Okay, and talking about the stages in cervical cancer, does it depend on the person or the type, or does it tend to move slowly or progress pretty quickly?
Yeah, so it's all kind of different, and it really depends on the exact type and when somebody comes in. The way that we stage, the way that I kind of describe stage is, where is it? We know that it started in the cervix, but the definition of cancer, it means that those cells have gained the ability to go wherever they want. Usually, cervical cancers will progress what we call locally, or in the area where they started. So we have to really determine what's involved with the cancer, where it is, and then address those areas in particular. And that's how we determine stage, and therefore that guides treatment.
Okay, so once we do the treatment, can cervical cancer be cured?
So it can be when we find it at early stages. Yeah, so certainly, you know, again, that's the goal of screening. That's the goal of finding women early enough that we actually have the ability to cure them.
Okay, so if somebody has cervical cancer or even HPV, does it affect their ability to have a successful pregnancy?
So it can, and again, this gets back to when we find it, what we find, and how we need to guide treatment. So for precancers or for cervical dysplasias, I was talking about removing those cells that are abnormal. And there are some risks with pregnancy, but most women can go on and have a normal pregnancy, even when we do those procedures to remove those cells. Once you have a cervical cancer, then the risks become a little bit different. Now, with early cervical cancers, there still are procedures that we can do that would allow women to go on and have a pregnancy as well. There are certain risks to that, and you know, those, you know, we need to counsel women about, you know, what that involves, because there is a portion of the cervix that usually needs to be removed. But when we find it early enough, many times we can preserve fertility in these women.
Okay, so when we're talking about, let's go back to the vaccine and the men and everything else, because it seems to be, I mean, certainly cervical cancer seems to affect a lot of people, right?
Yeah.
When we talk about the men and the kind of cancers that they can get, can you elaborate a little bit there too?
Yeah, so they're what's called oropharyngeal cancers, or cancers that affect the head and neck, and usually these cancers are kind of in the back of the throat there. So those are the HPV-related cancers.
And so what about, I know you're not the expert on screening for those, but I mean, are there any symptoms or anything that anybody would be able to tell this is from HPV?
Yeah, so there's no symptoms that they can tell that it's from HPV. Usually once a cancer is identified, they can identify which cancers are related to HPV, and there is no screening per se for oropharyngeal cancers, at least at this point. There are different studies that are going on that are looking at that and trying to identify that, but right now there is no screening for that.
Okay. All right, we have another question from social media. This one is from Shelly. Good question, Shelly. Is HPV only caused by intercourse?
So not necessarily, no. There are other ways to acquire HPV. Oral sex can cause HPV, and that is actually what's related to head and neck cancers. And there are other ways to acquire HPV. Sometimes, you know, other sexual acts can transmit the virus as well, but that is the most common.
Okay, so let's say that somebody knows that they have HPV, because you said it's pretty common, right?
It is very
common. A lot of
common,
people have it.
yeah.
Is it a situation where you should maybe reach out and alert partners or past partners, or is that not even necessary?
Yeah, so again, this is a very prevalent virus. So it is kind of everywhere, and most people will acquire it. So it's not kind of one of those things that, you know, you may even know about necessarily, or that you need to let a partner know about. You know, certainly if you've had effects from HPV, then it's good to let your partner always know about, you know, what's going on with you. But, you know, many times people may not even know. It may be from the past that they've had this, acquired it, cleared it. So it's a hard thing to kind of keep track of, if that makes sense.
Okay, so if somebody has questions about HPV, they want to see you, they want to come into your office, how can they find you?
Yeah, so I think there's a website up there. So that's our website for how to contact us and how to contact our division at GBMC.
All right. Well, thank you so much
Excellent.
for joining us
Thank you so much
today.
for having me.
All this great
Appreciate the
information.
opportunity
It's
to talk
invaluable.
about this.
Thank you.